an XLIF procedure. An extreme lateral interbody fusion, also known as a XLIF, is a minimally invasive procedure performed through the side of the body to remove a damaged disc and fuse the area for stabilization. Through the lateral approach, the cutting of sensitive back muscles is avoided, as well as the cutting and manipulation of ligaments, nerves, and the dural sac. This approach generally takes less time in the OR, creates less scarring, surgical pain, and a quicker return on normal activity. Typical symptoms include numbness, tingling, burning, and/or sharp shooting pain down the back, legs, and feet due to nerve compression. As the symptoms progress, a patient may begin to experience weakness in the legs or feet. Regardless of the issue, the disc is removed and is replaced with an inner body. The inner body comes in different heights and sizes, so it can be customized to each patient's body to ensure proper realignment of the spine. The middle of the inner body is hollow, so a bone graft can be placed. This sparks the vertebrae above and below the graft to begin growing together. Over time, the bone growth fuses and creates stabilization. This is why you may hear the surgery referred to as a fusion. Depending on how well the inner body stabilizes the spine, the surgeon may also need to place a plate and screws on the side of the vertebrae for additional support. Some patients only require the inner body. Bone growth is slow, so the fusion process could take 6 months to a year or longer in some patients. An XLIF is typically performed on the lumbar spine, which contains 5 vertebrae. It is hard to reach the L5 area through the side of the body. Therefore, this procedure is used generally for L1 through 4. Depending on what portion of the spine is fused, some loss of movement with bending or twisting from side to side may be noticed. If you are having surgery at L1 to 2, this is considered a level 1 fusion because only one disc is being replaced. Surgery at L2 through 4 would be a level 2 fusion. If compression from the vertebrae is seen on the spinal cord, some patients may also be required to have a posterior lateral inner body fusion, which means the surgeon would perform a second procedure with an incision on the back to stabilize the spine here as well. If both the side and back stabilization is needed, your surgeon will let you know.